Local and state elected officials in the Willimantic area organized 2 community forums to hear from residents, patients, advocates, physicians, and caregivers about the impact of proposed service cuts and staff layoffs at Windham Hospital.
The outcry that has already come from this community has made a huge difference in the plans that Hartford HealthCare has.
Our patients and their families deserve access to quality, essential health care services in a safe environment and without having to leave their community to receive this.
The decisions that you make as Hartford HealthCare are decisions that will impact the whole area because it will put additional pressures on other hospitals.
Transports to another hospital, it plays havoc with our cross-staffing model that we use. Most incidents when we transport to Windham Hospital are wrapped up in anywhere from 15 to 30 minutes. Out-of-town transports can take up to 2 hours from start to finish.
People will die in transit because on a Friday or Saturday night, when everybody's out drinking and whatnot, a lot of accidents, helicopters are up in the air, there's only so many.
Are we going to be outsourcing and having our community drive over half an hour away for these services?
We should be close to home, not going elsewhere.
If we downsize the hospital and get rid of ICU, this will impact these patients tremendously.
It's really about the fact that we are finding out what is being planned for us way after critical decisions have been made.
I was stunned about several days ago, early in September, to learn that the Office of Healthcare Access had made a determination that no certificate of need was required in this case.
We are concerned about the proposed reduction in services at Windham Hospital. We ask the Office of Healthcare Access to re-examine the consequences of closing Windham Hospital's ICU.
The Division of Medicine did vote that it was not in the hospital's best interest to close the intensive care unit.
Without a doubt, reductions in staffing will have both immediate and long-term negative repercussions to the economy throughout Eastern Connecticut.
I care about those jobs not just because they're my neighbors, but again, because I rely on those people to provide me and my family with the care that I feel we all deserve.
My business is job growth and job creation, and I'd like to work against retraction. So if there's any way all the parties can get together and turn this retraction into some kind of expansion or at least stability, I think that would be a good thing.
As caregivers, our main concern is patient safety and satisfaction. That is why we are demanding that Hartford HealthCare put patients before profits.
What is missing, in my opinion, is a hospital plan that continues to address the needs of the community and not just the needs of the hospital.
I, for one, think that Hartford HealthCare ought to stay in Hartford and take care of the problems.
We're going to fight this. This Hartford Hospital CEO has no idea who he's dealing with, but he's sure going to learn.
Hartford HealthCare should be ashamed of themselves. For them to say that they are a nonprofit is like the National Football League saying they're a nonprofit.
Hartford HealthCare's top executives were raking in millions, plus bonuses and incentives. This leads all of us to wonder why top administrators would be so handsomely rewarded while allowing our not-for-profit community hospital to bleed money. They should instead lead by example and reduce their excessive compensation, not cut vital services and make the inequality here at Windham worse.
Sign the petition and tell Hartford HealthCare not to cut vital health services or dedicated caregivers in Eastern Connecticut, and put patients before profits.
Patients before profits.